Welcome to EdPalooza and to our first live Q&A session. We're so excited to have Amanda Ripley joining us, and I'm so grateful to each and every one of you for tuning in. Amanda, welcome. It is so wonderful. This is your second event with us. Several years ago, you participated in our in-person summit and talked about The Smartest Kids in the World, that book. It was fantastic. I hope everyone goes out and buys it if they don't have it already. We're so excited to have you back here to talk about a book that you actually wrote before that called The Unthinkable, Who Survives When Disaster Strikes and Why. And even though you wrote it before Smartest Kids, it is just so absolutely timely for us and what we're going through today. Before we get started with our first question, I want to let the audience know that if you want to do a chat, if you want to ask a question of Amanda, please feel free to post that question in the live chat. And after a couple of questions here, I'll get to some of those audience Q&A. So Amanda, in your research on disasters and how we respond, a lot of the things that you highlighted were things that were sudden events, like an earthquake or tsunami. But tell me, in your research, did you notice things? Did human response or behavior change when it was something like the pandemic that was kind of slow in coming and prolonged over a period of time?
You know, the interesting thing is, first of all, it's good to see you, Patricia. I'm very glad to be here again. The interesting thing is that we seem to go through the same phases, but we cycle through them over and over. And we see that. So there's sudden disasters, there's slower ones, like Hurricane Katrina would be an example. Because most hurricanes, you have warning in advance, and then there's a long process of recovery, most serious hurricanes. So that's another analogy. But I think a lot about when people undergo individual disasters, right? Like severe cancer, or the loss of someone close to them, or anything that produces chronic stress and strain on a family or a community. And we know that what happened with the pandemic was sort of predictable in that way. For example, we saw that initial period of delay and disbelief. We saw it particularly at the official level, which we always see in pretty much every major disaster. So we saw public health officials and politicians being very slow to realize the magnitude of what was happening in China, at the World Health Organization, in the US, all over the world. Again, for understandable reasons in some cases, and in other cases because they were prioritizing other things, or didn't trust the public, or didn't have the pre-existing knowledge or expertise to understand the implications of what was happening. And then we saw that second phase of deliberation, right, which we see in every disaster, and we are still in it. So if you notice, what's happening around the country is that people are responding very much according to what their group is doing, right? So I know for myself personally, I live in Washington, D.C., and for a long time, I didn't wear a mask when I would go outside on a walk or a run. I read what I could read. It seemed like it was fine, and it's, let's be honest, it's terrible to go running with a mask on. It's uncomfortable and unpleasant. And then someone yelled at me to put a mask on. And in DC, like some other places, masks have become a sort of symbol of something else, right? And because it's a very left-leaning city, masks have become a symbol of, political and moral goodness. And so now I wear a mask every time I go running. I hate it, but I'm responding to the social cues around me, right? And you're going to see that variance from place to place, as we have seen. We've even seen it with school reopenings, right? Schools are reopening based on politics, whether the place is red or blue, much more than based on science, which is totally heartbreaking. But what it goes to show is that we rely much more on the people around us, our groups, our families, our neighbors, than we do on sort of expert insight, particularly as this goes on, but that's always true. So there are some similarities, I think, although it's obviously drawn out over a much longer time span.
Yeah. When I was watching your presentation and I listened to you tell the story of Tilly Smith and her parents' reaction, and I thought, if my 10-year-old and 12-year-old were telling me the same thing, I would put on my mommy hat. We're on vacation. It's okay. Everything's going to be fine. We'll talk to your teachers next week. And so I was a
Right.
little convicted of that, by the way. But then I also started thinking about, what if I was Tilly and I saw the danger, or I knew there were things that were going to be happening and people that I loved and care about weren't taking it seriously enough. You know, in your book, you had the story about the grandfather who didn't want to evacuate New Orleans when Hurricane Katrina was coming. What advice do you have for those of us? What can we do to break through to people that we care about who maybe are in that pausing, phase?
Yeah. So I think there are two tips that I use. The first is tell personal stories, or find personal stories that you can share. The more storytelling can be used to make threats salient to people, the better things will go. And that's particularly in the case of a pandemic, right, where you have more time as opposed to a tsunami. In a more urgent scenario, what we've learned from people who study human behavior on plane crashes and in other high stress events is that assertive commands work really well. So if people are not listening to you, or disbelieving, or ignoring you, one thing that works very well is to get very assertive, bordering on aggressive probably. And people who, when I did training with first responders and firefighters, and that's what they do as well, is they kind of bark orders. It's not the gentlest of approaches, but people do tend to respond to it, particularly when it's personalized, right? We know from the psychological research that if you say to someone, I need you in the blue shirt to go do this right now, they do it. So, so assertive commands are very important. And the last thing is, you have to be willing to be made a fool out of. You have to be willing to be wrong, just like anyone who takes any risk in any situation. I remember I got back from reporting on Hurricane Katrina years ago, and I had been there for Hurricane Rita as well, and there was just a lot swirling in my head. And I got home to our apartment, and my mother-in-law was there visiting. And that night there was a series of loud explosions at like 10 p.m. in DC. And none of us knew what it could be. And I was immediately like, grab your stuff, let's go, we're getting out of here, And it turned out it was some kind of dramatic Chinese firework event at the Kennedy Center. And of course, my mother-in-law has never let me forget this, right? Like, I will never live it down, which is fair. But you have to be willing to be wrong. And obviously, you don't want to do something dramatic. But I think in that case, maybe it wasn't wrong to be like, okay, this is not normal. And I'm aware that sometimes bad things do happen all of a sudden. And so I'm going to take some constructive action.
When you talked about Christian and how when he went back to Thailand and he saw the bus accident, he acted much more decisively. Is this because he had regret from the first experience where he could have done something, or did disasters change all of us? And all of us would act differently the next time a disaster hit. And if it's the latter, what will Americans do differently in the future after going through the pandemic?
I think everyone is changed by going through a disaster or any kind of trauma. And sometimes the change leaves us more resilient, and sometimes it leaves us less resilient. And I think for Christian, in some ways, he was more resilient, in some ways, he was less. So that's kind of typical. But he did understand, as anyone who goes through an unexpected, sudden mass casualty event understands, that the world can change very quickly. And so that wasn't news to him. It wasn't inconceivable to him, right? So in that sense, he was able to push through disbelief much more quickly. And you see that in other disasters as well. I remember there's a gentleman I interviewed who had evacuated very quickly from high up in the World Trade Center on 9/11, like way before anyone else on his floor. And I was talking to him about it because on average, people waited about 6 minutes to begin that evacuation process. Again, for good reason. In some cases, they were being told not to leave by the Port Authority. But in his case, he disregarded all of that and just hightailed it to the stairs. And which was smart, obviously, in retrospect, because it takes a long time to get out of a skyscraper. And I asked him about that, and he said, I don't know, I think it might be maybe because, my house had burned down 2 years before in the middle of the night and we'd had to evacuate, or maybe it was when I was a kid and there was a fire next door. And he had all these examples of, unfortunately, things that he had lived through. But so he had a mental model, is the technical term, for things just going bananas. And he knew that every day would not be like the day before, and he acted more quickly as a result.
Yeah. It's so true how things, impact that perspective in the future. One of the things that you talked about in the Ed Talk was touched a little bit on school shootings and active shooter drills, and that there needs to be a balance between, how much we prepare, particularly young kids for, so that you can create kind of this instinctive response. So our audience today has school level leaders, district level leaders, state level leaders. Can you go a little bit deeper in giving them a framework for how to balance education, preparation when they're dealing with kids, and maybe even for our lawmakers, for the broader public, right? Give them a little bit more framework on that.
Yeah, I mean, the people know their communities best. And so it's very much about localizing your risk. So assessing what are your risks given your location. There's some good work being done at FEMA now to help people map their community's risks, and online for free. So that's very important and something that the federal government should be doing more of. I think part of it is knowing your risk, but then overlaying it on your community's dread level. So there's certain risks that we really dread already, like school shootings, right? Then there's other risks that are high, but much higher than school shootings, but we don't feel dread. And that's like a technical term, dread. So like car crashes, right, would be one where most people don't feel a huge amount of dread, but they're much more likely to happen. So it's about mapping that risk and then looking at where is the dread level on average in our community for those risks. Where's the experience level? If you're a place that has experienced a lot of flooding in the past, then you have a different baseline understanding of it. There's an expertise in the community for it, as opposed to a place that has never dealt with a risk, but that's still likely to happen, right? Like earthquakes. So part of it is figuring out where are those likely risks where there's low dread and low expertise, and then training around that and finding ways. I would really encourage people to try to think creatively of ways you can deputize and empower all of your students, as well as your teachers and staff and citizens, so that they all feel like they have the expertise and experience and authority to make decisions in a disaster. What you don't want to do is be like the Port Authority and telling everyone to wait for further instruction, right? That's not a good plan in a disaster. It's also not good for your mental health. I mean, I think humans like to feel like they have some agency. So finding ways to kind of give people the muscle memory for, if it's evacuating, knowing where the stairs are and going down the stairs, at least a couple of flights, is very, very important to take one small example, because it's very hard to think in an actual disaster. So if you have that muscle memory, you're going to respond much more quickly. So again, giving people a chance to try something, to be part of the solution, and ideally finding ways to prepare that are dual use. Like they not only increase your resilience if a disaster happens, but they increase your sense of community. So finding ways, like there was a town I describe in the book where they did a tsunami evacuation drill, and people would all go up to this high high ground in this little town in California, and then they would do a punch card, like an old-fashioned time clock, to show how long it took them to get there. And what they found is that afterward, everybody just hung out, and it was like talking and socializing, and so that's kind of your perfect sweet spot for preparedness, is where because then you get something out of it either way, right? You build your community resilience either way.
Yeah. You brought up resilience a couple times. How do educators use the pandemic and build resiliency in students so that they're even stronger after this disaster?
Yeah, I mean, look, I think that what this disaster reveals is that we have a crisis of trust in our country. It is a national security crisis. It makes us very vulnerable. And so what I would love to see is communities make rebuilding trust a huge priority, rebuilding trust in our schools, in our politicians, with our news media. We cannot function as a society nor ever achieve what we're capable of unless we get much, much more trust in our system. And there's different ways to do that, but it is hugely important. There's an opportunity to do it now. And if we miss that opportunity, then, shame on us. I mean, it is, I just did a large story, so I'm thinking about this a lot, that hasn't come out yet, about how the last and only major institution that Americans still trust is the military. But if you look back, they didn't always trust the military. And a series of things happened, right? One of which was the military underwent a series of very public, difficult, transparent reforms in the 1980s. And it was controversial. It was unpleasant in some ways, but they were acknowledging their failures and listening to policymakers and politicians and the public. And that's an extremely important first step towards rebuilding trust. So I think that's something that I would really urge people to get creative on.
Yeah. Last week, when we were talking in preparation for this week, you touched on a book that you're currently writing, which is about how people behave in conflict. Tell us a little bit more about what you're learning and how that applies in education.
Yeah, that book, it's sort of, in some ways, I'm only realizing now, follows the same formula as The Smartest Kids and The Unthinkable, in the sense that I follow people who have undergone a transformation of some kind, right? So in Smartest Kids, it was following American teenagers to other countries with stronger education systems. And Unthinkable, it was following people who had survived disasters to learn what we could learn from them. And High Conflict, I follow people who have been locked in really dysfunctional, poisonous conflicts of different kinds, political, personal, and gotten to a place where they've made that conflict healthy again. So it's not that the conflict goes away. We really do need conflict. Yeah. It's that they made it healthy and constructive again. So I think that's something that, when I think back on education and how I covered education as a reporter, I think if I were to do it again, I would definitely do some things differently, knowing what I know now about conflict. And everyone here knows that education has a lot of conflict in it. One thing that I would do less of is this sort of binary sorting of people into camps in the way I think about the problem and the way I write about it. I think that's extremely unhelpful and also not accurate. So this idea that there's a reform camp and there's a union camp and everybody falls neatly into one or the other is simply not true, and also feeds into a lot of our worst human biases when it comes to conflict and adversarial us versus them thinking. So that's something that I would maybe not call the head of the teachers union every time I need a quote, right? Don't call the people who what they're going to say, right? Call people who have complicated and real life experience and are not going to neatly line up in one category or another, which that is one thing that I always find helps is call the students, quote students, because they don't neatly fall into one political category or another. They tend to be more straightforward. They have a lot of experience that rarely do we learn from. So that's one way I think to mitigate against that problem.
Great. I'm going to take a couple of questions from the live chat. Ralph Krause is asking, with there being different levels of disaster in everyone's lives, has there been a major theme regarding the people that you have interviewed in your career in regard to persevering through adversity?
Yeah, I mean, it's interesting. I think lots of people, eventually everyone experiences some kind of disaster, like major or minor, individual or mass, right? The experience is somewhat similar. Some people experience them when they're very young without very much support. And that's very hard. The stories that we tell ourselves about the trauma and suffering we experience are hugely important. We know that now from the research. So I guess I'd say that the themes that I see are that people are capable of unbelievable resilience, and it's not always directly correlated with the level of loss they've been through. It has a lot to do with the level of support that they had before. And this is something that is so obvious, right, in the pandemic, is that the health and functioning and trust level of a community before a disaster directly predicts the outcome after. And it matters more in some ways than the actual hazard.
Yeah. We just experienced, even in our own organization after the first shutdown, the number of people that moved, right? Wherever they were locked down the first time, they moved to be closer to friends or family in case there was going to be another, real shutdown in their area. So that need for family and support is, you could see it playing out a lot of places. We have another question from Carrie Donkey. I would love to hear Amanda Ripley's thoughts on the role misinformation might play in these sorts of situations.
Oh my goodness, good question. There's a couple things we know about how people will behave in major public health emergencies. And there's like 4 conditions that need to be present, and people will do amazing things. Like people will put up with a lot of sacrifice. Those 4 things typically are transparency, consistency of messaging, and fairness. Like they need to be asked to do something that's fair. It's like everybody's required to do it, not just some people. And it needs to be feasible, right? Which gets to your point, Patricia, just now. You cannot ask people to have no social interaction for a year. That is terrible for public health and mental health and all kinds of every health. So that's not feasible. I do wish, and I remember talking to an epidemiologist early on in this pandemic for a story, and I was like, what can people do? Like, you guys keep telling us what people cannot do. What can people do? You have got to start telling us what people can do, because people are not going to just stop doing things indefinitely. But they were so reluctant to say what people can do. So she told me, people could go bike riding. That's fine. And I was like, thank you. Thank you, God. So I put that in the story. And then she calls me and she's like, yeah, I don't know if I can say, I'm nervous because someone else said maybe you can't. I'm like, oh my God. So we have, again, you have to take a little bit of risk, give people something to do. Don't just tell them what not to do. So that's very frustrating. And I now realize I haven't answered the question. I'm so sorry. I got carried away. Misinformation. So that second item, right, was consistency. You've got to be consistent and transparent. When you have inconsistent messaging in a low trust environment, as we have in the United States and around the world right now, thanks to lots of different things, including social media, but not just social media, then it is extremely difficult to get that public health compliance over time, right? Because people will always just choose the message they want to hear. That's very normal, very natural. So if you give people a bunch of different risk options, like wear a mask, don't wear a mask, worry, don't worry, they're going to choose the one they want and the one that their social contacts are choosing. Yeah. So misinformation is a huge vulnerability in our society and around the world.
Yeah. This question comes from Cynthia Floyd. What recommendations would you have for school personnel as they support students in following COVID safety guidelines when those students' parents are still in that disbelief or denial phase and are resistant to some of the guidelines?
That's a good one. Well, I think back to like firefighters are really good at this, right? Remember how firefighters always visit schools and they always let kids get in the truck and try things out. Mm-hmm. And they make it kind of fun. And they realize that kids are often more open to this kind of information than adults because they have fewer pre-existing biases and prototypes cluttering their brains. They're more open and they're also more willing to be wrong because they're wrong all the time and they make mistakes all the time. So telling stories is hugely important at this moment. So finding stories of people who are like you or like your kids' parents, and there's some are written up in the media, some are going to be personal. That's extremely important right now, as opposed to going to the talking points and the CDC guidelines. Mm-hmm. At this point, unfortunately, those are not as salient. So telling stories around it and really raising up the kids who are putting the collective good ahead of their own comfort, I think you can shift the frame so that the kids are the heroes of these stories. And that's hugely important to do. The kids out there who are wearing masks while they play soccer and football, and the kids out there who are, dealing with a lot of hardship in their own lives. And instead of framing that as just victims, I think framing that as of strong kids is a really helpful way to go.
Right. So for the policymakers, kind of the elected and appointed officials that are watching, how can they apply some of the understanding on human behavior to deal with disasters or things that they're going to encounter, like an economic crisis or a future natural disaster in their state? What should those lessons be for them?
So the opportunity exists, particularly I think going into the new year, to be very explicit about, maybe it's creating a trust commission, maybe it's working with, bringing together someone from the union, someone from the new TV news outlets, someone from faith organizations, bringing them all together to really listen to the public about how we can rebuild trust in our institutions. And this is super important, like telling that story with the most powerful storytelling techniques and expertise that you can access. That's what the military did in the 80s and 90s. And there are differences, obviously, but I do think it is possible to rebuild trust. We've seen this in other countries, but it has to be done very explicitly, and the story has to be told many different ways. And it requires a lot of listening to the public, like people typically don't feel heard, and that leads to the extreme behavior. So I think, again, I if I had any authority at all, which I don't, which is probably good, then I would really focus on explicitly rebuilding trust. This country is capable of incredible things, and we are not going to be able to achieve them at this level of frayed social trust.
Yeah, so true. Amanda, so this is my last question for you. After experiencing the pandemic, is there anything that you would add to the book, or is there a point in your book that you think is even more powerful today than it was before the pandemic?
Yeah, I would definitely put the pandemic in the book. It would be like its own multiple chapters. I think that I did talk in the book about how the health of a community before a disaster is more important than the disaster itself. But I don't think I truly understood the extent to which that is true when it comes. I mean, I knew it was true like in New Orleans before Katrina, right? I mean, New Orleans was a very dysfunctional place before Hurricane Katrina. You know, the courts, the cops, all of these things were broken and not trusted. Education system was not functioning. So that is something we knew about before, right? Like we knew those were big problems in New Orleans. People in New Orleans knew those were big problems. But I don't know if it's always viewed as a existential problem, right? It's sort of viewed as like these are separate problems in their own silos. But when you have that level of sort of civic failure, you might as well be opening yourself up to like foreign invasion. Like it is literally a huge, huge risk factor unto itself. So we look at risk, we look at like, you know, earthquake faults, and we look at hurricane trajectories. But if there's not strong community and organizations that people trust across divides, political divides, religious divides, racial divides, those things don't matter that much, you know? So that's something I might spend more time on if I were to redo the book.
Yeah, thank you. Amanda, thank you so much for joining us here today, for participating in EdPalooza and doing the Ed Talk, and for answering our questions. You are one of my favorite authors, and I'm so glad we were able to have you back here for EdPalooza. And I want to thank all of the audience, the EdPalooza guests, for joining us today. I have a couple of quick reminders for everyone. We're going to take a 30-minute lunch break right now, so you can come back refreshed and energized for the Palooza sessions this afternoon. The first block of Palooza sessions begins at 1:45 Eastern Time, and you're going to want to log back in a few minutes early so you can get into the session that you've selected. But also know that you are able to go in between sessions this afternoon. So if you want to change your mind and go to a different session, you can do that. Since this is our first day together, I want to mention that all the Palooza sessions are going to be recorded, and that they will be available for our attendees for 60 days after the event, so you can go back and catch any sessions that you've missed. I want to invite you to be a part of EdPalooza on social media. Use the hashtag EdPalooza and @ExcelinEd. Thank you so much for joining us. See you back here in 30 minutes.